Us guys can get quite desperate. Early ejaculation is super frustrating and we feel immense pressure to get it sorted. We resort to methods that range from questionable to downright bonkers and dangerous. These are the things that you shouldn't do, in order of dodginess, in my opinion. Overuse of numbing sprays. This is a common one because delay sprays and creams can be quite effective and they are generally safe to use. And there are lots of different brands. Usually they contain lidocaine or benzocaine. Now the instructions always recommend a certain number of squirts in one application, like 3 to 6 sprays. So guys read this and they think, well, I want the maximum effect and I don't want it wearing off too soon. So 6 squirts and then some more, and now I've lost track. So let's have some more just to be sure. Squirt, squirt, squirt. And what are the risks of this? Too much of this can lead to irritation or an allergic reaction, and trying to have sex with absolutely no sensation in your penis is not ideal, because you could do regrettable things with that, or things that your partner might regret. And if you use this much, it's not going to fully absorb, and it's going to be difficult to wash off, and your partner is going to get the numbing effect too. I can't feel my mouth, etc. So go easy on the numbing. Most men only need a bit, and just around the head, the tip, is where we're most sensitive. Alcohol or recreational drug use. A social drink to relax us a bit before sex, why not? But getting wrecked before sex or before trying to have sex is not optimal. Some guys rely on weed or cocaine or other substances to slow themselves down. Now this comes with significant risks. It impairs our judgment for starters. Again, we might do regrettable things for us or our partners. We can develop a dependency and a conditioned feeling that we have to be smashed or stoned in order to perform. And then we feel like we can't have sex without it and we're stuck in that trap. And all the negative health effects. Some substances can even dangerously lower our heart rate or blood pressure during sex. Supplements and herbal remedies. Ancient potions and things that promise to give you ultimate stamina and control. Pills and herbal balms that you rub into your penis too. Now we might think, oh well, even if they're a rip-off, they just won't work, so no harm done. But there are real risks, because some of these unregulated ingredients have significant side effects, and they can interact with other medications. And some of those balms, they aren't numbing products. Oh no, they're the opposite. They deliberately irritate, and it does have a distracting, delaying effect. But you apply too much of that, or you get it inside your urethra, and you'll discover the true meaning of prolonged burning. Physical hacks. So we have the death grip strategy, where guys masturbate with a really tight grip in order to desensitize their penis, or they just masturbate that way because they like it. Sometimes guys have read that too much grip causes delayed ejaculation, and they think, I'd like some of that, so they adopt the death grip. Or squeezing the penis during sex, because there is this old squeeze method in sex therapy, where you or your loving partner gently squeeze below the head for a few seconds for a delaying effect. But some guys are grabbing and squeezing really hard, holding it around the base sometimes to hold everything in. All this squeezing and strangling can cause issues, pain and even permanent tissue damage. The other thing that some men resort to is inserting objects into their urethra to block it up and stop themselves coming. I just can't even think about that. Just no. Dodgy medications. SSRI pills have a legitimate delaying effect. Fact. And if you're going to go that route, speak with your doctor about a prescription. Duloxetine, aka Prilogy, may be an option too. It's an SSRI especially developed as an on-demand treatment for PE. But bypassing advice and assessment and buying such things directly online, I don't recommend it. There is some risky stuff out there. Combination pills, where an SSRI will be mixed with some variant of erectile dysfunction medication like Viagra for 2-in-1 effect. Stay hard and last longer in the same medication. That is a lot of medication in my opinion, so just be very careful. And people are self-prescribing other meds like beta blockers to try and reduce their performance anxiety and get that delaying effect. There are too many risks and potential side effects for me to list here, but with all of these things, think blood pressure issues, heart problems, serious interactions with other medications. Always go through your doctor. injecting Botox and other things. Now, Botox is being considered as a safe and effective treatment for PE. Research is ongoing. Now, note that we're talking Botox injections into the bulbospongiosus muscle, which is a muscle in the perineum area, behind the testicles, not in the penis itself. Now, there's research into injecting bulking agents, such as hyaluronic acid, into the glands of the penis. And this would seem to have some sort of numbing effect. It's all at clinical research stage as far as I'm aware, but no doubt there are practitioners offering these treatments already, because penis filler injections for cosmetic purposes have been around a while. Be cautious if you're even considering anything like this. But even more extreme, there are reports of men self-injecting. Doctors have seen guys who injected their penises with Vaseline, silicone and other random substances in order to bulk up and last longer. Some of them needed skin grafts as a result. DIY hormone therapy. We know that as men get older, from about 30 onwards, their testosterone levels tend to dip, sometimes resulting in lower sex drive, less energy, less muscle mass, and sexual difficulties. Now, this is a natural effect of aging. So there's a huge market for testosterone boosters, a lot of legitimate treatments, and a lot of self-prescribed supplements being bought online. Many using estrogen blockers and other hormonal treatments without medical supervision to have more control over their ejaculation. Now, interestingly, the links between testosterone levels and PE are complicated and not fully understood. Relatively low testosterone might be minimally associated with early ejaculation for some guys. But some studies suggest that high testosterone might be a factor too. Either way, taking a DIY approach to modifying your hormone levels is really risky. It can wreak havoc on your mood, your fertility, and your long-term health. And that's why a lot of medical professionals don't generally recommend testosterone supplementation until you're at least 50. And with potential increased risks of cancer, liver damage, hypertension, prostate problems, we should be looking at supplements as a last resort, prescribed by a doctor. Surgical modification, top of the list, the nuclear options. Now, surgery has become more of an option in the last 10 years or so, and there are procedures that target the penile dorsal nerve, which plays a big part in our sensitivity to stimulation and our ejaculation reflex. So there's a neurectomy, where a surgeon cuts away at branches of this nerve to reduce its function, or blasting the nerve with coldness or high-frequency radio waves. Or there's the inner condom procedure, where a layer of acellular-dermal matrix is implanted under the skin of the penis, reducing sensitivity. Now, there are positive studies of men who've undergone all these surgeries and had good outcomes, lasting longer without significant side effects. The trouble is, there aren't many studies, and this is all quite new, so we're not too clear on the longer-term outcomes. And regulation is essential here, because the risks are significant. A neurectomy is invasive, and PE can come back anyway. It can also cause pain, erectile dysfunction, penile curvature, and psychotic episodes. So along with all the usual risks of infection or complications from surgery, this is hardcore stuff. Are there unlicensed clinics and practitioners offering these procedures? Yes, they are out there, multiplying all the risks, of course. That's why surgery takes the top spot here. It can go horribly and permanently wrong. All of this highlights the anxiety and pressure that a lot of men feel about lasting long enough in bed. Our desperation for a quick fix can worsen the problem or lead to significant health issues. I'm here to tell you that there are safer, evidence-based approaches. See pretty much every other video on this channel, and my self-help course, which pulls these methods together. So as a psychotherapist with some expertise in this area, my motto is skills, not pills, or surgeries, and not supplements either. Yes, there are products that can give us a temporary confidence boost and help us develop our sexual skills, but we want to make them redundant in the long term. We don't want to be dependent on these things or do more harm than good. I hope this is helpful. Don't do these things, and thank you for watching.